If your doctor just celebrated because your blood pressure finally reached that perfect 120/80 and you are over 75 years old, stop and listen carefully, because that number may not be protecting you at all. In fact, for many older adults, it may be silently putting their life at risk. Not from high blood pressure, but from blood pressure that has been pushed too low. A major study published in JAMA Internal Medicine, one of the most respected medical journals in the world, followed more than 15,000 adults over the age of 75 for 5 years. These were not perfect textbook patients. These were real people with diabetes, heart disease, prior strokes, kidney problems, and all the complications that come with aging. And the results shocked many researchers. Older adults whose blood pressure was pushed below 120 had significantly more dangerous falls, more kidney complications, and a higher overall death rate compared to patients whose blood pressure stayed between 130 and 140. Read that carefully. The ideal number many doctors aggressively chase was linked to worse outcomes in elderly patients, and almost nobody is talking about it. Most patients walk into the doctor's office believing lower is always safer. That message has been repeated for decades. But after age 75, the human body changes dramatically, and blood pressure targets that help a 4-5-year-old can seriously harm an 80-year-old. Yet every day, older adults are still being treated with the exact same numbers. Subscribe to DR.Camila and hit like right now. This channel exists to bring honest, evidence-based information directly to the people who need it most. Too many seniors are being over-medicated without understanding the risks, and today we are going to talk openly about what is really happening. I'm DR.Camila, and over the years I have watched this exact situation repeat itself again and again. The 7-9-year-old who becomes dizzy every morning but assumes it is just aging. The patient whose blood pressure looks perfect sitting in the clinic but crashes dangerously low when standing up. The older adult who suffers a devastating fall in the middle of the night after medications pushed their pressure too low. Today I'm going to explain why standard blood pressure targets after age 75 can become dangerous, what blood pressure range is actually associated with better survival in older adults, and the simple test you can perform at home tonight that may help prevent a catastrophic fall before it happens. Let's start with what happens every single day in clinics across the country. An older patient walks into the office, maybe 78 years old. Blood pressure reads 145/85. Immediately, the doctor sees a number above guideline targets and reaches for medication. One prescription becomes 2. A few months later, blood pressure is now 122/76. Everyone celebrates. The chart looks beautiful. But nobody asks what happens after the patient leaves the office. At 2 a.m., the patient gets out of bed to use the bathroom. Within seconds, blood pressure suddenly falls from 122 down to 90/58. Blood flow to the brain drops. Vision blurs. The room spins. The patient reaches for the wall and misses. Now we are no longer talking about blood pressure numbers. We are talking about a broken hip, emergency surgery, hospitalization, loss of mobility, weeks in rehabilitation, loss of independence. And for many elderly patients, a fall like this changes the rest of their life forever. This is not rare, and the frightening part is that it is often preventable. The problem is simple. The rules that apply to younger adults do not apply the same way after age 75. For decades, medicine followed one central belief: lower blood pressure is always better, and in middle-aged adults, lowering blood pressure absolutely reduces heart attacks, strokes, and kidney disease. The evidence for that is very strong. But aging changes the cardiovascular system in ways many people do not fully understand. The first major change is arterial stiffness. Healthy arteries are flexible. They expand when blood moves through them and help maintain smooth circulation throughout the body. But as we age, arteries become stiff and hardened. Doctors call this arteriosclerosis. Imagine an old garden hose left out in the sun for years. It loses flexibility and becomes rigid. When arteries stiffen, the body often needs slightly higher pressure to push blood effectively to critical organs like the brain and kidneys, especially when standing upright. A blood pressure that looks too high on paper may actually be necessary to maintain adequate circulation in an elderly body. The second major change involves something called baroreceptors. These are tiny pressure sensors located inside blood vessels. Their job is to rapidly detect changes in blood pressure and help the body adjust instantly when you stand up or move suddenly. In younger adults, this system reacts within milliseconds. Heart rate adjusts, blood vessels tighten, and blood flow remains stable. But after age 75, those sensors become slower and less responsive. That means when an older adult stands up, blood pressure can suddenly drop before the body has time to compensate. This condition is called orthostatic hypotension, and it is one of the leading hidden causes of dizziness and falls in older adults. The third major change is medication metabolism. At 75 or 80 years old, the kidneys and liver do not process medications the same way they did decades earlier. Drugs stay in the body longer. The same dose that works safely in a 50 year old may become far more powerful in an elderly patient. Blood pressure medications can accumulate slowly and push pressure dangerously low without anyone noticing. That is why a sitting blood pressure reading inside a clinic often tells only part of the story. Now let's go back to that study involving more than 15,000 adults over 75. Researchers divided participants into groups based on systolic blood pressure, the top number in a reading. One group stayed below 120. Others ranged between 120 and 130, 130 and 140, 140 and 150, and above 150. The most surprising finding: the lowest mortality rates were seen in older adults whose systolic pressure stayed between 130 and 140. Not below 120. Patients whose pressure dropped below 120 experienced significantly more serious falls, requiring hospitalization, higher rates of kidney injury, and a noticeably higher overall death rate. Meanwhile, extremely high blood pressure above 150 still increased stroke risk, so very high numbers remain dangerous too. But the critical lesson is this: for older adults, blood pressure that is too low can become just as dangerous as blood pressure that is too high. Let me give you a real-world example. Imagine an otherwise independent 77-year-old patient. During a routine appointment, blood pressure reads 142/84. Medication is prescribed. A second drug is added later. Eventually, blood pressure reaches 121/74. The doctor says everything looks excellent, but the patient begins noticing strange symptoms. Every time they stand up quickly, vision dims for a moment. Walking across the room causes lightheadedness. Fatigue becomes constant. Brain fog develops. Most people dismiss these symptoms as normal aging, but often they are signs the brain is not receiving enough blood flow when standing. And this problem is frequently missed because doctors only measure blood pressure while the patient is sitting still. That is why every older adult taking blood pressure medication should know how to perform a simple orthostatic blood pressure test at home. You can do this tonight. All you need is a standard blood pressure monitor available at most pharmacies. Here is how the test works. First, lie down quietly on a bed or couch for 5 full minutes. Relax completely. After 5 minutes, measure your blood pressure while still lying flat and write down the numbers. Then stand up immediately and measure your blood pressure again right away while standing. Now compare the results. If the top number drops by more than 20 points, or the bottom number drops by more than 10 points, that is considered orthostatic hypotension. For example, lying down, 126/78. Standing, 98/64. That sudden drop means the brain may not be receiving enough blood flow while standing. And for older adults, that dramatically increases the risk of dizziness, fainting, falls, fractures, and hospitalization. If you are over 70 and taking blood pressure medication, this test should become part of your routine health monitoring. And if your doctor has never checked for it, bring your results to your next appointment. Now let's talk about realistic blood pressure targets based on current evidence. For adults between 65 and 74 who are generally healthy and active, a systolic pressure around 130 to 140 is often appropriate. For adults between 75 and 84, the optimal range frequently shifts slightly higher, around 135 to 145. And for adults over 85, or those who are physically frail, systolic pressures between 140 and 150 may actually be safer and more protective overall. The goal changes with age. At this stage of life, preserving brain function, balance, mobility, and independence becomes just as important as reducing cardiovascular risk. Diastolic pressure, the bottom number, matters too. In older adults, it generally should not fall below 65. Very low diastolic pressure can reduce blood supply to the heart muscle itself and contribute to weakness, fatigue, dizziness, and cardiovascular stress. This is why blood pressure management in older adults should never follow a one-size-fits-all approach. Consider two patients who are both 81 years old with blood pressure readings of 158/88. One patient has kidney disease, arthritis, poor balance, and heart failure. The other plays golf twice a week, walks daily, and has no major health problems. Same age, same blood pressure, completely different medical reality. The frail patient may be harmed by aggressive medication lowering. The healthier patient may tolerate treatment differently. This is why individualized care matters so much. Unfortunately, medicine often moves slowly. Many current guidelines were originally built around studies involving younger and middle-aged adults. Those targets eventually became generalized to everyone, including seniors, even though aging changes the body dramatically. And changing medical practice takes years. Many physicians are still following older protocols while working inside rushed systems with 5-minute appointments that leave little time for individualized discussions. So what should you do after watching this video? First, if you are over 70 and taking blood pressure medication, begin monitoring your blood pressure at home consistently. Measure it morning and evening for 2 weeks and keep a written log. Second, perform the orthostatic blood pressure test regularly. Third, pay attention to symptoms. Dizziness, weakness, blurry vision when standing, unusual fatigue, brain fog, or balance problems may all signal blood pressure that is too low for your body. Fourth, speak directly with your doctor about your target range. Do not simply assume 120/80 is automatically correct for your age. Ask this exact question. Given my age, medical conditions, and physical health, what blood pressure range is safest and most appropriate for me personally? Bring your home readings. Bring your orthostatic test results. Become an active participant in your care. And finally, never ignore medication side effects. If you feel weak, dizzy, mentally foggy, or unstable after changes in medication, say something clearly and directly. Those symptoms are not just aging. Your treatment can often be adjusted in ways that still protect your heart while reducing dangerous side effects. The evidence is becoming increasingly clear. For many adults over 75, aggressively lowering blood pressure below 120 may increase the risk of falls, kidney injury, orthostatic hypotension, hospitalization, and even death. For most healthy older adults, systolic pressures between 130 and 145 appear safer and more appropriate. The older and more physically vulnerable a person becomes, the more individualized those targets should be. Do the orthostatic test tonight. Start tracking your readings. Have a serious conversation with your doctor about your actual personal target range instead of blindly chasing a textbook number. Because your blood pressure is not just a number on a screen. It is directly connected to your balance, your independence, your brain function, your safety, and your quality of life. And nobody is going to advocate for your health more than you. Subscribe to DR.Camila and leave a like if this video helped you understand something important about your health. We are building a community focused on honest medical education, one conversation at a time, so this information can reach the people who truly need it.